Hey guys, this is Dr. Mahajan from Mahajan Medical Center with another exciting edition for our webcast for today. I'm very excited that we got a very special guest, Dr. Mira Mahajan, and she is my lovely wife, as you all know, and she's a house expert dermatologist as well. Her training, as you know, is in family practice, but she took some extra training in the derm, and then for last, since she joined Mahajan Medical Center for the last many years, she has been performing a lot of derm procedures and cosmetic procedures very successfully, and patient love that we do in-house derm. So that will be something you will not have in a lot of primary care offices. So we're very proud of her to provide that in-house service. For those of you who don't know me, my name is Dr. Ranjan Mahajan. I'm a board certified internist, and we have a Mahajan Medical Center here in Largo, Florida, and it is a uh, state-of-art facility with in-house derm, and we do a lot of procedures in-house, like skin injection. I'm sorry, the joint injections, and we draw labs in our office. So let me get Dr. Mira on the screen without further ado. And Mark is saying, here we go. Thank you, Mark, for your nice comment. Yes, he is very nice and very professional. I can vouch for that. Thank you for listening to our webcast and such a loyal patient. Appreciate your help, Mark, in giving us the enthusiasm. Uh, Carolyn and Ray are watching. Thank you, Carolyn and Ray. They've been our regular listener. Let's get back the Mira on the screen. All right, here we go. Hello, Dr. Mira. Welcome to our weekly webcast. I know uh, we are doing uh, husband and wife duo, but I'll treat you as a special guest too. Don't worry. um, Go
Well,
ahead.
thank you for having me here, and thank you for all our listeners to sparing some of your time and spending this evening with us. So I do appreciate that, and I'll be try to come to your expectations and answer all the questions. Whoever have any issues or any questions can feel free to ask. So today, as Dr. Mahajan or other Dr. Mahajan said, we're going to talk mainly about skin care and skin screening and sun protection. So I'll try to cover as much as possible in very simple terms. But if you have any question, or Dr. Mahajan, if you have any question you want me to elaborate, I'll be more than happy to do that.
So let me ask you a first question right off the bat. Um, I know you like surgery. You had a GYN background, and then when you came to Florida, you did your family practice residency and became board certified family practitioner from Bayfront. How did you get interested in skin?
So my training is in surgical the OBGYN. So I like procedures. I like surgery. And when I was doing my training in family medicine, I got the opportunity to learn to do some procedures. And we were given the choice that we can do procedures on the skin, we can do procedures on like some even on like colonoscopy, or our program director was very good and he said, yeah, you can choose your passion in the last year of your residency. And living in Florida is very hard on the skin. So we can see the skin issues, skin problems, skin cancers a lot here. And since it is procedure based practice, so it kind of got me excited even more. So I chose to have extra training, and I chose to have all the interesting facts about the skin, and of course, my passion about cosmetic procedures also is related with the skin. So that's why I kind of chose. And of course, I do my normal practice, and my other passion is OBGYN, and we do women health, pap smears, and the all yearly women checkups here too.
That's fantastic. What's the other passions you have other than the skin cancer screening, skin procedures, and then you also do woman exam in our office. I know you have a cosmetic practice as
Yeah.
well. So tell us about a little bit about your cosmetic practice too.
Well, our cosmetic practice is again because it's a procedure based practice. I got to use some of my old training of doing procedures, doing some surgeries, to now do some lasers, some injections, and make pretty people even more prettier, like them healthier. So now in this era, people are more aware of their health. Our life expectancy is increasing. So we just want to look what we feel inside. So if you are active, you're exercising, you're eating right, why not just look great too? What do you want to look like? So we have a lot of non-surgical options now, which we didn't have 10, 20 years ago. So with the minimum downtime, with little procedures, we can improve the appearance of the people who are already beautiful from inside.
We got a comment from our friend Rashmi. She's saying, should kids wear sunscreen too while going out in sun? Great question, Rashmi. Let's put it to expert Dr. Mira.
I will try. I will going to go over that in detail, but our sun damage, 60% or more happens during our childhood. So when we are running around in the sun for so many hours, we tend to get sunburn. And after sunburn, we most of our skin cell can repair itself, but some of the 1% or less which cannot can lead to precancers or cancers 10, 20, 30 years later. So when we are young and child, that's the most important age to do the sun protection. Sun protection is also important for skin cancer prevention, but also preventive anti-aging, because our 60% wrinkles come from sun and smoking. So healthy habits should be started as early as possible. And some people are more prone to get skin cancers, like people who have fair skin and very light color eyes, people who get sunburned easily should pay even more attention.
That's a
So
great.
yes, yes, I'm going to go over like even the sun protection, how to do it. If you have to use sunscreen, what type of sunscreen, and how to wear it properly.
Okay, yeah, that's great. We'll definitely, delve more into it, at that point. So, let's get started on the skin cancer and skin lesion, not just skin cancer. Let's talk about, the skin lesions.
So
Um,
we can go over that. People come to us with some of the skin lesions or things they see on their face or on the body, looks bad, but we get confused with the skin cancer. So I try to put few pictures together that some of are non-cancerous and some can be cancerous. So we
okay,
can differentiate a little bit and go from there. Yes.
okay, great. Let me, bring up that screen. Let me share the screen about that. So, right. So, let's just make it bigger. All right. So, the skin lesions could be, non-cancerous, and then they could be cancerous, right?
Yeah.
So,
So
okay,
some of the skin lesions are non-cancerous. They are benign. They are harmless. They're just like nuisance, like they don't like them there, and sometimes we get scared, like, oh my god, what's going on, is it cancer or not? Some can be pre-cancer, they're maybe transitioning from just the sunburn for over the years into skin cancer. Like picture you have right now, looks like just overgrowth of our sebaceous glands, or those oil glands we have on our face. They can be confused with the basal cell, but actually they are completely benign. That means non-cancerous. So I'm going to go over a couple of the pictures here, which
so this is
very common.
benign what we have up here, Dr. Mira, the sebaceous hyperplasia, correct?
Yes, yes. So this is benign. That can be confused with the basal cell, but it's not. So some very common lesions we have and this is next one is seborrheic keratosis. And they are like more, you can feel them, a lot of people have them, and we tend to get them as we age. They are can be different types, like more waxy, they can be different colors, you can feel them, and people get to them on their back. They almost never change into skin cancer, thankfully, but they can look scary, they can look
Right.
ugly.
Yeah,
Yeah.
it does look like a cancer, but it is not. So that's good to know that a lot of things are benign, but it's good to come and see you, and you have a look through the dermatoscope, which kind of magnifies it, and with your expert eye, you can tell, and then you can always take a small biopsy. So yes, so anyone has lesions they are suspicious, they should not just Google it. Yeah, they can come to our office, make an appointment, and then like for example, this one, Dr. Mira, the sebaceous keratosis, that looks ugly. That's crusted, it's
Yes.
raised, and it's like tortoise shell.
Yes,
Um,
because actually a lot of people, I put it there, came for these lesions and they look like they're scary. They have asked Dr. Google and Dr. Google scared them even more. But I found other skin lesions, other precancers and cancer, which they were completely was unaware of. So that's good. Like it doesn't hurt to get anything checked. But these are some just pictures which look like mole or melanoma, but they're not. They're completely benign, never change into skin cancer. But they can grow, they can be irritating. People can pick on that and they can get inflamed, and that's the reason we remove them too.
okay, great. The next one up, that again inflamed seborrheic keratosis, same class.
Right, it's the same thing. And Max was showing like a lot of lesions on the back, that how much they can have them and how they look. So yeah,
Right. So the next one up is again the more on the back.
yes,
Okay. And these are all benign, again in the same
these are benign.
category.
These are
Yeah.
non-cancerous, and then these ones we tend to get almost all we have. They're very bright red, round. We can feel them. They are just overgrowth or blood vessels underneath the skin. We tend to get them with time and age. These called cheerio angioma. So very common to have. Don't change into skin cancers, but um, it's good to get checked.
Now, Denise has a question. She's saying, how do you get flawless skin? Can she get a flawless skin too? So, what's your secret, Dr. Mira? Do you want to tell your folks out there the floppy hat, the sunscreen? Uh, I don't want to give you all the secrets, but you can give some more.
Yeah, my before 20 years of age, I think we can just give thanks or blame our genes or our parents. But after 20, you have to work on it. You have to do something to keep it um, look the best you can. The healthy nutrition is definitely the 80-90% of your healthy glowing skin. A lot of fresh fruits and vegetables, a lot of hydration, and wearing sunscreen. So that covers my 80% of the skincare, and after the rest of it is all our marvelous lotions and lasers and everything comes after that.
Right. So that's a great point. Be proactive about sun protection, which we'll come to in a minute, and then use the right kind of uh, creams, which they can make a appointment with you and in the cosmetic side, and you can help them there. So okay, let's go to the next one up, which is
It is
the
it's a normal mole, so it's a normal mole which is not precancerous or cancerous, so they can look like just black dots, or sometimes they are have no color, sometimes they are like little rays. So these are just the normal moles which are not changing or not atypical, or they but it's good to have chat too. So the normal mole is like small, they have even color, they are very round and symmetric, which is completely opposite of the precancerous and the cancerous, which is called melanoma. And I will
right.
go
So
further.
let's get to a little bit in between. Now this is a atypical nevus. So how is that different than the melanoma?
So when you see this one, like how it is like a little bit bigger. So if you have said it's almost like a centimeter more. So normal moles or typical moles should be less than 6 millimeter or so. So to be on safer side. And how these borders are changing. So borders are not nice and smooth. So how it is like trying to grow in the rest of the skin and epidermis. So that's not a good sign. The other people who have like atypical nevus syndrome, like you have lot of big irregular moles all over their body, are more prone to getting melanoma or pre-melanoma, as I call them, atypical moles.
Okay, great. Let me just go to the. All right, so this one is, the same thing, but multiple of them on their
Right. So
back.
some people have that, and it's more genetically, so it runs in the family. These people have just lot of moles, and as I showed you the picture, it looks very similar to lot of seborrheic keratosis, but they're totally two different things. So these people has to be extra careful for their sun protection. They has to be and looked at regular basis, like every 6 months to once a year. Skin scanning is required, and in our practice, we take pictures. We also measure even each and every mole. So when we're doing regular checkups, so we can see their progression, so make sure they're not growing or make sure they're not changing their behavior, so we can stay on top of it.
Okay, great. That's a great idea. Now, I think Cheryl had the same question about this picture we have of the actinic keratosis, and her question is, how serious is actinic keratosis? So I think that's a great segue. Why don't you get into that now?
So actinic keratosis, how actinic means from sun, and keratosis is something like going on with the skin. So this is more precancers, and most commonly they may lead to a squamous cell carcinoma and sometimes basal cell too. So you see those pink lesions, and which has like this rough scaly lesion on that, and you can peel them off, but that scaly lesions come back on top of it, so it doesn't go away by itself. So some of them our body can take care of it and heal itself, and some they just can't. So when I was talking about the sunburn which happens 10, 20 years ago, and then these some little less than 1% cells which were not able to repair itself, and which our ability to repair itself goes down with the time. So they may land up, some of them they land up on areas which are more sun exposed and sunburns, like a scalp, upper back, chest, face, and nose, and on the dorsal side, like means outside of your arm and forearm, where we see most of the sun lesions. So these are a little irritating because they feel like rough, they don't look good. But why are we worried about actinic keratosis? Because they can be precancerous. So that's why we do kind of monitor them closely. We treat them, and most commonly we can treat them with like liquid nitrogen spray. And then so they come in crops. Like when we got sunburn, we didn't got sunburn on one place or one lesion. So it's an area. And in that, sometimes we can have a bunch of actinic keratosis or precancerous. So we kind of go and look at your skin every once a year, or and some people who are high risk once in 6 months, and treat the lesions which are bigger with TCA or liquid nitrogen, some kind of therapy.
All right, let's talk about the ABCDE criterias, for the, whether, that, how does that help, whether they are cancerous or benign? Do you
Yeah,
want
so
to go at
uh,
length?
some dermatologists came together and went over to differentiate between a normal mole and a bad mole or atypical mole or even melanoma. Like if somebody is looking at themselves and looking at, okay, should I worry about this or it's okay? So that's why we came with this A, B, C, D, E to make it simple so everybody can understand. And there's some pictures to go with it. So A is just going with symmetry or asymmetry, like you have a mole and you kind of a fold and together, so it should be like mirror image of each other. If they are not, like other half is looking different, then so they are asymmetrical. So if it's asymmetrical, then it's more chances they can be atypical mole, which is pre-melanoma or melanoma. Or if the borders are not regular, nice and regular, if they're irregular, color variation, like one area is lighter, one area is more darker, it's not even color, that's another not a good sign. Diameter, like how big they are, bigger they are, more chances of getting into pre-melanoma or melanoma. So the thing is, like, if you don't know what is 6 millimeter is, like it's a back of the pencil eraser, tip of the pencil eraser on the back of the pencil. So if it's bigger than that, then we should worry about it. And if they're changing, if they're like itching, bleeding, doing something funny, or changing rapidly, or increasing in size rapidly, then we also kind of look at that. So these are easy things to remember when you are doing your skin screening at home.
Okay, good to know. And the next one is the superficial spreading.
So this is just showing that how this is so asymmetric. You can see the half side is so dark, and as other side is so light. So this is not a good sign. So if you keep going on the next pictures, I'll quickly go over the next slide. So this is like how the borders are irregular. You can see a couple of notches now it's going inside. So it is not considered a regular border. So we are just going through ABCDs of the moles. And the next one, please. So this is the next slide, the before in the moles. So yeah, so this is another thing. It's asymmetry. It's a lot of things going on that it's even the bump inside and the color is different, the border is different. So these are all a couple of lesions if you understand what ABCD means.
Okay, great. So the A stand for asymmetry, the B stand for the borders, which is around. If they're
color.
C is color, D is the diameter. The bigger it is,
Yes.
the bigger the chance of it's being cancerous. And E stand for what?
Evolution that just they're changing into like the itching, bleeding, they're doing something funny they're not supposed to do.
Okay, that's good to know. So these are the bad ones, the melanomas. So you definitely want to get them looked at right away. And you need a little bit deeper biopsy for them, correct?
Yeah, so there are different type of biopsies we do in for the mole or any pigmented lesion. They want to see the full thickness of the skin, so we do punch biopsy. Like it's a round, and then you go in the punch, so we can see everything in the skin. Sometimes even shave biopsy, which is more superficial, like we numbing the area with the lidocaine and taking a very small superficial piece of it. So there are really three types of skin cancer. And we covered melanoma first because melanoma is the most aggressive, most dangerous. It spreads into our body more aggressively. So that's what we are concerned about the most. That's what we worry about the most. And that's why we look at the pigmented lesions the most. The other more is, the squamous cell and basal cell. So all three of the skin cancer are from the sunburn, or when you have a lot of like multiple sunburns going on. The melanoma also is related to more genetic predisposing factor. So sunburn is more related to like squamous cell and basal cell. And melanoma has both factors, genetic and sunburn.
Right. So this is a squamous cell, and they can go to the lymph glands, correct?
So squamous cell and basal cell can go into the body, but they don't known for rapid metastasis. Metastasis is when they are going not locally but somewhere else. They're through the lymph nodes, the lymphatic system. Like melanoma can go into liver, to your brain, which can be very dangerous to people. But the squamous cell and basal tend to erode and invade locally, deep into the skin and surrounding area first, and then they go to your local lymph nodes. That's the kind of a squamous cell. And basal cell is like, it's also called rodent ulcer, like mice. It sits there, eat the skin around it, and it takes years before they actually go and to the different places.
So this is a basal cell, pearly appearance and raised,
So
correct?
basal cell is more like a nodule. It happens and can be superficial spreading too, but you will generally see a deep like ulcer in the middle and some bunch of big blood vessels running around it from the
Okay,
vein.
and if you're gonna have a skin cancer, this is the one, good to have. You don't want one, but this is
Yeah,
more slow growing and localized, correct?
I will take squamous cell and basal cell anytime over melanoma. Melanoma is one of the most aggressive and bad skin cancer, not just skin, but anywhere in the body to have.
Now this picture, probably someone ignored their basal cell for a long time, correct?
Right. So as I said, the rodent ulcer, or why it was called like that. So if they ignored it, it's just how you can see how it's eating away the nose and the skin around it and the cartilage. So you don't want to go to that state. Um, that so it was just it can cause a lot of disfiguration, especially to the vital areas like top of the ear or the nose where people get a lot of sunburns. Unfortunately.
So that's like the ear and the nose, okay, because they jet out and they get a lot of exposure. In Florida, people don't realize, Dr. Mira, that even driving you get a lot of sun exposure. So you definitely want to put sunscreen on your ears and your nose, even if you're driving. So to prevent something like this, because that could be very disfiguring. All right, so we covered a lot of cancers very quickly, and we have a lot of ground to cover. So I'm just
I
going
also want
through.
to, yeah, I also want to add something about Florida because Florida is more close to the equator. We hit the, more harsh UVA and UVB beams here because more close to equator you live, more direct the sunlight you hit. And being on having the snowbird here, it takes years to acclimatize to get used to it. One kind of a environment. So if you are lives in a high sun area like Florida, your skin get a lot of tan. Your skin will become pigmented and brown, but it doesn't happen with snowbirds. They're living in the area which they hardly see any sun, and they just coming here and trying to cook into the sun, enjoying the sun a lot. So that's even more dangerous. And they need to protect their skin with the sun protection or sun protection clothing or hats and etc.
Do you want to go over the risk? What risk for melanoma? Because I think that's a very important topic. You
Right.
know, yes, go ahead, please.
So, do all over general, anybody like, especially white males after 50 and above, it's like everyone here. So, some people who I talked before, like atypical Nevo syndrome, has 50 or more moles on their body. If they have family history, there's somebody in their family, close to their family, has melanoma, they put them more risk of the getting the melanoma. If they have one or more dysplastic nevus already biopsied, and dysplastic nevus or bad mole, I'm calling it, is pre-melanoma. They're not changing to um, melanoma yet, but they're heading towards it, so it's more precancerous. Or if they have any kind of immunosuppression, or they have radiation for something in when they were young, and if or they're like having a very light color skin, light color hair, light color eyes, and especially they can like red hair. So these people are more risk to getting melanoma and other skin cancers too.
So in summary, if you have male above 50, you have nevus, too many nevus, and you got dysplastic or precancerous nevus for longer period of time, you're higher risk. Your family history of melanoma, childhood radiation exposure, immunocompromised condition, if you are on transplant drugs, red
Yes.
hair phenotype. So those are the one which should worry about anything which is colored or even non-colored but not looking good even underneath the fingernails. They should come and see you right away, correct?
Yes. They need to look at their skin once a month. Um, like you have to have a full body mirror in which you can look at the skin, and then also looking at the all the areas like your back, your hair, your toes, in between the toes, properly. And there's some pictures show how to, if you cannot see your back, like how to take a body hand mirror and the full body mirror, and with the two you can look all these areas. Um, because as I said, squamous cell and basal cell are present on most of the area which hit the sun, like upper back, nose, ears, face, chest. But the melanoma can happen anywhere. Um, Even you should look anywhere you have the skin, you can have a mole or which can turn into melanoma. So looking at your skin once a month, and of course, as I said before, you cannot differentiate. Some of the lesions can look and feel bad. So once a year, skin screening is a good idea.
Okay, so what you're saying is, get a full length mirror if you have the high risk factors or you out in the sun, when you're young and foolish. It's a good idea to get a smaller mirror, a handheld mirror, and look in the nooks and crannies like underneath your feet, underneath your nails as well, because they may be hiding there. All right, great. So you want to cover the sun protection a little bit. What are the good sunscreens? And someone had a question, Beverly had a question. How about freckles? Is there any risk with freckles?
Uh, yes. So freckles, some people don't like them, and some people think they are cute. But nobody is born with freckles. The freckles, no, you have not seen any newborn baby who has freckles. The freckles are developed in the early childhood, where they're exposed to sun, when they are trying, running around. So what freckle is, our skin has a special cell. It's called melanocyte. Its job is to produce pigment. People who are pretty fair or people who has light colored skin, they doesn't have enough melanocytes. So when they are hitting the sun, their skin is trying to produce a lot of pigment, and they're blotches of pigment. So they are freckles. The skin is trying to protect itself to making a lot of melanin. Mostly freckles are does not cause an issue, but they can rarely change into skin cancer. So if the freckles are nice, fine, flat, regular, it's okay. But if they are changing their shape or they're growing rapidly, or they're doing itching, bleeding, that needs to be checked and that needs to be biopsied.
Okay, great point. Let's go back to the sun protection. What do you advise to folks who are listening to you? How much sunscreen? What's the teaspoon rule? How much? What kind of sunscreen is your go-to sunscreen when you're recommending to people? Whether zinc oxide, titanium oxide.
Yes.
We talk about
So
sun.
the
Go ahead.
sunscreen should be used. It should be broad spectrum. Number one. So most of the sunscreen available in the market are broad spectrum. That means they're covering UVA and UVB both. They should be at least, the sun protecting factor should be at least 30 or more. They can be chemical or they can be more physical. The physical is more zinc and titanium. Zinc and titanium are better than other chemical based. Two, they're more environmental friendly. They're more, they're better for your skin because they're more just physical in that. So zinc oxide, the titanium oxide, they are the better sunscreens. Um, and how to apply it? The sunscreen should be applied around 20 to 30 minutes before going to sun, and that's how they start activating and start working with your skin. The amount should be proper. They should have like a thin layer or a general teaspoonful rule, so that it's kind of a protecting your whole skin. And again, they should be reapplied every 2 hours. And if you're going in the water and sunscreen is washed away, then you should apply uh, that time. So sometime, if you're not using it properly, it gives you false protection sense. Like actually, you think I'm protected with sun, and you're not. So it's very important to know and use it properly. And sometimes it's like too much area to cover with sunscreen. So nowadays there's a sun SPF clothing or sun protective clothing. So using your sunscreen is a really great idea, but I recommend using your hat, your sunglasses, and those SPF shirts is a good idea. But I understand that young people, they want to see show off their body. So if you want to use the sunscreen all over, then you have to apply a good layer, and 30 minutes before going out in the sun, and a proper amount, and reapplying every 2 hours.
That's great point. Let me just bring the screen up, and that covers a lot of good points you brought up. So basically, the different kinds of UV radiation, and unfortunately, in Florida, we get all kinds of UV radiation. We have sun galore. So, applying the SPF 30, the broad spectrum Dr. Mira talked about, when you go out to work, sports, any rec activities, again, teaspoon rule, at least you should apply it liberally all over, and then reapply it every 2 hours, which we forget sometime. If you go out and beach and we go in the water and we come out, we need to reapply it again. And that's another touchy topic with the reefs and the sunscreen. So you got to be using a sunscreen which is reef friendly. And the protective clothing is another great idea. All right, Dr. Mira, any other pearls of wisdom? Let's get some comments here. We got, let's see, Mr. and Mrs. Gupta had a comment. They're saying useful information. That's very kind of them, Mr. and Mrs. Gupta, and they're a regular watcher of the show. So we appreciate you doing that. Any particular
So
suggestion if
I
you're
would
dark
say,
skinned?
yeah, skin is our biggest, largest organ. So be nice to it, pamper it, protect it, and it'll protect you.
Now,
So
let me bring
all
up
I can say,
Denise saying again, how does your skin look flawless? Again, people who tune in later, you want to tell it again?
if you think my skin looks flawless, then thank you so much. We will try, because that's what we have to practice before preaching. So having your nutrients, I try plant-based diet. That's mainly my diet is 80% is fruits and vegetables.
Well, here is a question for you then. How does your diet affect your skin condition? Mark is always ahead of you, Dr. Mira.
Yes, diet as anything else. We are made of what we eat. Our whole cells in the body changes every so years. Every 7 years, your whole body is changed. So the diet affects our skin, our mood, a lot of health conditions, and balance is the key. Like too much of everything is kind of is not good. So balanced diet affects our skin, our the hydration, how we regenerating our skin, as any other organ. So it's completely vital. So skin is not different than overall your immune system, your all health system. It's part of it. So if you having a balanced, healthy diet with good hydration, your skin is more looks healthy, it glows, it looks beautiful. So if you're sick and you're not doing well, like if you are diabetic, your immune system goes down, your skin looks dull, you have more chances of infection. There's kind of ulcers. You lose your sensations, and I can go on and on and on just about that, how diet affects your skin, and everything else on that.
That's a great point. Let's thank you folks who has been watching patiently to this lot of information. We got, let's see, we got Jan Loesch watching. Thank you, Jan. We got Betty Gonzalez watching our show. Thank you, Betty. Seth Lee's watching. Thank you, Seth. Kathy Hall is watching. Thank you, Kathy. We had such a good event yesterday with you folks. So thank you for watching. John Ritchie is watching. And let's see, Beverly, we already brought her question about freckles. We have, Dr. Mira, another question about freckles. Do you want to, Deborah Hawkins have freckles. Are they need to be more careful if they have freckles in terms of monitoring for skin cancer and doing more sunscreen and hats? What's your take?
Yes, so definitely any pigmentation or which is not completely uniform has to be closely watched. So that means just doing skin screening at least once a year if they never had any skin cancer before, using your sunscreen properly when they're in sun, using their hat and the glasses. And I hope they like their freckles. They're cute. But they need to be make sure it's not like growing or they're not changing color. They're looking okay. So somebody just need to watch them. And sometimes freckles and age spots are two different things. So they need to be kind of differentiated. So yeah, I'm not against freckles. I mean, as I said, some people like them and some people not. But most commonly, people who are like light color skin and exposed to the sun tend to get them. Really, they can, unfortunately, can turn into skin cancer. So proper screening is definitely required, and the sun protection.
That's great points, Dr. Mira. All right, so any final words of wisdom before we go to the raffle for the good folks who watched our show with Jenny on the previous Thursday, and we got a Publix $25 gift card coming up. So I'll give you the full camera attention for your final words of wisdom. I know that Dr. Mira comes to our Mahajan medical site twice a week, and anyone who has anything of suspicion should definitely see her. And she does a great job with her dermatoscope and her experienced eyes to look for anything suspicious, and she can take a biopsy right there and then. And if she needs to refer to someone, if it's more like a melanoma, then we have a network of good physicians, surgeons, plastic surgeons, oncologists, God forbid. So we can take care of all of your skin needs right here at Mahajan Medical Center. So that's a wonderful service we offer. So let me bring you back up, and there is a question from Debbie. Let me bring that up. Uh, Yes, Debbie, if you're concerned about your lesion changing color, or you're worried, that means anything you're worried in the skin, you should definitely see Dr. Mira, and she can guide you. And she said she'll call you tomorrow. That's very kind of.
Well, I just want to thank you everyone to spend the time with us, giving us time and being here. I do appreciate that. So my training is a family practice. So being more why I do them in my practice, so just more convenience to our people, because they want to do, they can take care of these women health issues and skincare health issues here under one umbrella, under one roof. So it's very convenient for them. But we do biopsies here. I do skin screening, biopsies, and the cryo, other procedures, some excisions too. But if you need a like more surgery or other help, we kind of do referral. And it's good to always have a um, choices or an option to take care of your skin here or go to somewhere else wherever you prefer. But as I said before, like anything else in our body, our skin needs a lot of protection because it needs to protect us. So good moisturizer, good diet, hydration, and sun protection is the key.
Great advice, Dr. Mira. A lot of patients have given fantastic testimonials about your, surgical skills. I've seen you do such a good job with suturing that people after 6 months, a year, does not even know that, there were any skin cancer removed. So, it's good to have in-house expertise with someone like you. So, all of our patients love you, and we appreciate the work you do for them. So thank you so much for coming to our show today, and we're going to move on to the raffle, and then we're going to do three-part breathing.
Thank you.
Thank
And
you.
thank you everyone again, and have a nice evening. And we'll see you soon.
All right, guys. So this is what we got up next: the Publix gift card for the people who, good folks of you who participated in the raffle, to putting comments. So anyone who's watching, please put comments, and that will get you in a raffle when we do our show next Thursday at 4:30. It's going to be a fantastic show. Let me just for the folks who missed out on the sun protection tips, let me bring that up one more time so you can read through that. That's a great slide which talks about what you need to do about protecting your skin, since we live in sunny Florida, which is a double-edged sword. It raises our morale, giving us vitamin D and gives us sunlight, but also makes us more prone to all kinds of skin cancer. So if you can follow the tips Dr. Mira gave you, I put it up one more time on this slide for you to make notes. That will help, and we'll bring Dr. Mira back again. If you want to down the line to get some more ideas, maybe we can show our surgical skills. We have some videos, we can play that as well. All right, so coming back to the raffle, I know you guys are getting eager about that. Let me pick up a raffle slip here. Please do put comments. We got Michelle saying, thanks for the tips. It's greatly appreciated. Michelle, thank you for being a loyal listener, and appreciate you commenting. That put you for the $25 gift card for the next Thursday webcast. So do tune in. All right. And then the winner is, let's see, who's the winner? All right, Cindy Smith. Cindy Smith is the winner for the $25 gift card. If you do watch it later, you can still put a comment. Let's say you come back from work and you watch our show on the YouTube or Facebook Live or Twitch or Periscope. Do put a comment. All right, so the next piece we're going to talk about is what's up for our next Thursday webcast. We got a very smart gentleman, Joe Tedesco. He's a independent broker, and since the open enrollment has started, on 15th, which is today, for the Medicare folks, he will bring a wealth of knowledge of different insurances. How does it work, and it will be good to pick his brain. All right, so we're going to do the three-part breathing now. Three-part breathing, as you guys done with me before, is very simple and very effective. What I mean by three-part breathing is that you're using your abdominal core muscles, your diaphragmatic muscles, and your intercostal muscle just below your clavicle. So what are the benefits? The biggest benefit is uh, it expands your lungs, and also it helps you calm down. So if you're meditating in the evening before you go to bed, You can do the three-part breathing, and if you sit down upright, you can do it that way. Even a better way is to lay down and bend your knees and watch your abdominal muscle go up and down and your chest cavity go up and down. So three parts of the breathing, as I explained, is your core muscle, the abdominal muscle, the diaphragmatic muscles, which we, in a busy life, day-to-day life, we only use intercostal, the shallow breathing, and that does not expand your lungs as much we have the capacity for. So if you have COPD, if you have heart failure, knowing three-part breathing will help you get your dead spaces, that electric spaces, expanded more. So let's do it. So put your right hand on your belly just to get a feel. And then when I breathe in, make sure your belly muscles go forward. And then breathe out, the belly button should go back. So that's what I call using your core muscles, your abdominal muscles. Now, the next step will be adding your diaphragmatic muscle breathing to it. So breathe in, the belly should expand, add another breath from your diaphragm. So now you got two parts covered. And now when you're breathing out, stay tall and get the air out from your chest first and then from your belly like this. You're pushing your belly button back. Now the third part is the part just below your clavicle, the intercostal muscles. So you go breathe in again, balloon up your belly, then add a diaphragmatic part, and then add a part just underneath your rib cage, the clavicle. Now you got all three parts ballooned up, your heart is raised, and then hold 1, 2, 3, and then breathe out, staying tall from your chest, and then push your belly button back. So you should not get dizzy, you should not get uncomfortable with this breathing. You should expand at your own comfort level and pace. Now we're going to do without stopping this time. This time we're going to do all three parts without seamlessly, the abdominal, the diaphragmatic, and the chest. So let's do it. Hold 1, 2, 3, stay tall, and then breathe out from your chest first and then your belly. Let's do three of those with me. Okay, let's inhale. Raise your heart up. Hold 1, 2, 3, and then breathe out. Stay tall from your chest first, and then push your belly button back. One more last time, and then we'll be done. Breathe in. Stay tall. Hold 1, 2, 3, and then breathe out through your chest and through your belly. So if you can do 15 cycles of that, 3 times a day, 2 times a day, depending on what time availability you have, and build up in next 3 to 6 months, you will see you will be breathing better. With that, we come to the end of our webcast. Look in your mirror and smile. You are a very important and wonderful individual. You should be proud of where you are, and be nice to yourself. Be nice to your family. Be nice to your neighbors and friends. Be nice to the whole biosphere and Mother Nature. And with that, we come to the end of our webcast. We'll see you guys next Thursday at 4:30. We're going to have Joe Tedesco, who is a broker and an independent agent, who will help us walk us through different complexity of Medicare in that podcast. Namaste.